Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, I'm going to go over what I consider the ideal candidate for knee replacement surgery. Before I jump into that, be sure to hit the subscribe button, turn on the notifications so you can catch all of our latest videos. So this is just kind of a activity I did by myself, trying to figure out if I had to make that perfect avatar of the person who kind of checks all the boxes, meets all the appropriate things, that a knee replacement surgery would be appropriate but also beneficial, and they have most likely a chance of being satisfied, low risk factors. What would that person look like? Of course, people are going to vary tremendously, so you're not necessarily going to check all of these boxes, but you still may be appropriate for knee replacement surgery. But just think as I go through this list, and think, am I similar to a lot of these things? Do a lot of these things describe me and my characteristics and what I'm dealing with? Or are a lot of these different? And where are those differences? And maybe you can discuss those further with a healthcare provider, a physical therapist, and kind of see where you stand in terms of getting a knee replacement. So first one is age. So the sweet spot I kind of put is 60 to 70 years old or 60 to 75 years old, somewhere in that range. And considering that, first I thought about we want to reduce the risk of needing a revision, needing to get another knee replacement down the road. So thinking about the longevity of a knee replacement, maybe 10, 15 years, sometimes getting up to 20 years now, a little bit longer for some folks. But the longer you can wait, the more you're going to reduce that risk of needing another knee replacement down the line. The other thing is, though, you want to be at an age where you have some strength, some mobility, some vitality left that you can kind of go through, the rehab and recovery after a knee replacement. So we don't want to wait so long that, you're very debilitated, you're very frail. It's going to make that rehab and recovery a lot more difficult. So I kind of put 60 to 70, 60 to 75 is kind of that sweet spot. Of course, some people are going to be younger, some people are going to be older, but I would consider that the sweet spot. Another big thing to think about, of course, is symptoms. So do you have pain? Do you have stiffness? Do you have swelling? Do you have crepitus, or the joints making those creaking and cracking noises and sounds? Do you have changes to the alignment and the mechanics of your knee joint? And the big thing is you may have these symptoms, but how significant and how frequent are these symptoms? And are they impacting you? Are they impacting your quality of life, your mobility, your ability to walk, go up and down stairs, get in and out of the car, get up from a chair, out of bed? Is it impacting your function, your activities of daily living? Are you able to go to the grocery store and walk the aisles and get everything you need? Are you able to sit in a chair and watch a movie? Are you able to get yourself dressed and get yourself bathed or showered? All these things, you want to think about, how significant are your symptoms and are they impacting your quality of life, where they're at a point where we need to address this in some fashion. You also want to look at, the imaging. So imaging, x-rays, a lot of people use that as the be-all, end-all, and I don't think it is, because people can have different things showing up on x-rays in terms of the extent of their arthritis, but then have different levels of symptoms and impact of their symptoms. But I would say that if you are considering a knee replacement, then you want to demonstrate that there is some arthritis, some moderate to significant arthritis in your knee joint. Some folks, some healthcare providers might disagree with me a little bit on this, but if you don't have very tremendous arthritis in your knee and you're dealing with knee pain, I wouldn't necessarily say let's go to a knee replacement. Let's look at what other things may be leading to and causing your pain and symptoms. If you don't have a lot of arthritis, why are you having this pain? And what can we do? What can we try to address that pain without going into surgery necessarily right away, at least? And so that kind of brings me nicely to my next point is, have you tried conservative treatment? So someone getting a knee replacement, best case scenario, we want them to try that conservative management. A knee replacement is a good surgery. It's not a great surgery. Not everyone is satisfied. There's risks of complications. There's, risks of just not having a great outcome for some folks. Thankfully, not for the majority of folks. So that's why we want to look at the conservative, less invasive strategies. So easy enough. First things, weight management, activity modification. If you're employed still, can you make some changes to your work so it's not as stressful and impactful on your knees? Changes to what you do, daily activities, hobbies. We want to look that you're developing a physical activity and exercise program. And of course, going along with that is a course of physical therapy. I highly recommend trying these non-invasive conservative management strategies first is definitely our first line of defense before we go into things that like surgery, and also I'll put in there injections, things of that nature that just are more invasive and carry some more risk. So have you tried conservative treatment approaches? Definitely a candidate for knee replacement. I would want them to have tried those conservative approaches first. Are you someone with reduced risk factors? So obesity, being overweight is of course a very big risk factor. It doesn't necessarily mean that you can't get a knee replacement. There are surgeons who operate on people with all different levels of BMI or body mass index, and you'll hear different stories and anecdotes from people. But obesity and being overweight definitely is a increased risk factor for having a complication from surgery. So ideally, you're someone with a healthy body weight for your size and your height. Going along those lines, if you're someone with diabetes or pre-diabetic, you have that well controlled. You have your blood sugars well under control to, again, help reduce risk factors. You're definitely not a smoker. Smoking is a huge risk factor for complications with any surgery or medical procedure. So really addressing those risk factors. Are you someone at a healthy weight? If you do have diabetes, is it controlled? And are you someone who is not a smoker? And then just more of a mental aspect. Do you have realistic expectations? And hopefully your healthcare providers, your doctors, your physical therapists can help provide this for you and help educate you accordingly about realistic expectations going into surgery. Understand that it's an intensive rehab process. There's going to be some pain, especially through the early weeks and months. It's going to take a while to get fully recovered and back to 100%. There's that risk of still, even if you do have a good outcome, some lingering symptoms, aches and pains, stiffness. But thankfully for the majority of folks, this is much better than pre-surgery. But just having that realistic expectation going into surgery, that these are some things that you can expect. And then probably the most important thing for the ideal candidate for surgery is someone who has a high level of self-motivation and self-efficacy. So you're someone who's taking an active approach to your health. You're taking an active approach to the knee replacement process. Now, knee replacement is passive only in the actual fact of the surgery itself. The rest of the process leading up to surgery, preparing for surgery, and of course all the rehab and recovery is a very active and involved process. And the more as an individual you're active and involved and participating and taking that initiative to be consistent with exercises and anything you need to do to manage your recovery and rehab, you're going to have a much, much greater chance of having a great outcome and being confident and being happy with your outcome from knee replacement surgery. So definitely someone who is motivated, has a high level of self-efficacy is honestly probably, all those things aside, is probably the most important thing. And it's probably the easiest thing. Well, I won't say easiest, but it is the thing that you can most control yourself. Your attitude going into surgery and what to expect and what you can do to contribute to your own health and well-being. So I hope you found this video helpful and insightful and gave you some insights if you are someone considering surgery or even if you're someone after surgery. Please be sure to hit that like button. Please be sure to subscribe if you don't already. And as always, leave your comments and questions and I'll get back to everyone I see. Thank you for watching.